the best piece of advice we can give is that benefits have open enrollment every single year. So take some time, reevaluate the plan you're choosing, especially if your circumstances change. If someone is taking up skiing for the first time, my husband talked about doing that in Vermont next year, and I'm terrified. You might want to see what's up there. Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
Who spend their working days focused on health benefits and healthcare.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits system.
I'm Jolene Myers.
And I'm Sarah Flusky. And we're ready to lament,
Complain,
empathize, and maybe help a few people. Today, Jolene, we're going to dig into one of the most important choices you make each year at work: which health plan to choose. If you're staring at a list of acronyms and wondering what you're supposed to do with the letter salad, this episode is for you. The reason that I think it's that important is because the plan you choose matters. It impacts you for the next 365 days. And not all plans are created equal. And I don't say that because some plans are good and some plans are bad. It really has to do with how you use your benefit plan. So we don't all have the same needs. A single, healthy 27-year-old is going to use benefits differently than a 27-year-old with a chronic condition. They're not going to use their plan the same way a family with 3 kids is going to use it.
No.
And a family with 3 young children might use their benefits differently than a family with 3 older children, 1 in college, 2 in high school. They're using their plan entirely differently. So the way that you need to look at your plan and evaluate which plan is right for me and my family based on our experience in this year, all going to be totally different. I would never say a high-deductible health plan is the right plan for everybody. I would never say a copay-based plan is the right plan for everybody. Got to think about how you use it.
Yeah, and it's important to remember in this year. Because everyone's health and wellness can change on a dime
100%.
at any moment. So it's a good mindset to get into as you're signing up for some of these benefits or enrolling in a plan. So we're going to talk about copays. What is a copay-based plan? We talked about the definitions around some of this in the last episode, but you might have a plan where you have a certain amount deducted from your paycheck. So say it's $1,000 a month. That's an investment of $12,000 over a course of a year. And by taking this plan, you don't have a deductible. So this is the amount you are spending whether you visit the doctor or you do not. A deductible means you have to pay a certain amount out of pocket before your copay or coinsurance amount kicks in. A copay is where you see that it costs $25 to go to a doctor, or it's $15 to see a chiropractor.
Coinsurance refers to the percent of fees that you're responsible for. So we might see a 20% coinsurance for the ER instead of a $250 copay. So if you have a copay plan, it might say $250 for emergency room, or it could say 80% of the expense of the emergency room is covered, and so you are responsible for 20% of billed charges. So in a copay type plan, the total cost for the plan year, the way you're going to calculate that is the amount deducted from your paycheck to enroll. So that's the $12,000 that you calculated earlier, plus any costs not covered by the plan, which is where you see your coinsurance or copay, that flat dollar fee or the percentage. So you would add $12,000 plus $250 if you estimate, I know that I get bronchitis every year. I end up with 1 ER treatment for bronchitis. So I'm going to calculate the $250 for that, plus the cost for me to see my doctor. I know I probably will end up there at least 3 or 4 times this year. So that $25 specialist copay, that's how I would estimate my out-of-pocket cost for a flat copay plan. If I'm a high utilizer of services and I know what kind of services those are, you can kind of estimate this is about how many times I would go to see this doctor. This is what my copay or coinsurance amount would be. And then that on a flat copay or coinsurance plan with no deductible, that's how you would calculate your all-in estimated cost for a flat copay plan.
Yeah, we don't have a crystal ball, but
No,
You know
you
your
have to
body and
estimate, right, based
yeah.
on your typical experience.
High deductible health plans.
Totally different. So it's exactly what it sounds like. A high deductible, you have to that's the amount that you have to pay upfront before any of those copays or those coinsurance values kick in. So you might see on a flat copay plan, it's $25 for a specialist as your copay, or it's 20% coinsurance, 80% is covered by the plan to go to the ER. Those dollar values in a high deductible plan don't kick in. They don't become the dollar amount that you pay until you have spent out yourself that high dollar value. So let's say your employer deducts $500 per month for you to participate in this plan. So not the $1,000 a month is the other plan, but it's only 500. And let's say that your deductible is $3,000. That means whether you get care or not, you're spending $500 per month or a total of $6,000 for the year just to be enrolled in that plan. And then you need to spend an additional $3,000. That's that out of pocket. So in addition to your $500 a month, you're going to spend an additional $3,000 out of your pocket before the copays kick in. But it sounds like a lot because it's $3,000 out of pocket, but so far, compared to the other plan, it's actually $3,000 less on its face.
But you gotta compare a few other things.
Yep. Yes. So at first blush, that it's $1,000 compared to $500, which is a savings of $500 copay plan versus the high deductible plan. But $3,000 out of pocket, it's a lot to kind of imagine setting aside an additional $3,000. So if you enrolled in a high deductible plan, you could contribute the balance, that other $500 into your HSA. So if I have plan A is $1,000 a month and plan B is $500 a month, if you take that other remaining $500 for the high deductible plan and put that in your HSA instead, your plans on their face are the same cost per month.
And you got money for braces in 10 years.
Well, that's the magic part of it, right? So if you spend out $1,000, you're spending $1,000 in the copay plan. If you spend $1,000 on the high deductible plan, you invest the remaining $500 every single month into the HSA. If you don't use it, you save it. So now it's your money. If you use all 3,000 of it, you've got it there set aside to use, but if you don't, that rolls over. You can take an HSA from job to job. You can spend it on copays, medical bills, orthodontia. The risk is that you experience a high cost event early in your plan year before you've had a chance to keep adding to the HSA. But a lot more providers and facilities are familiar with high deductible health plans tied to an HSA. So sometimes you have the ability to work with the provider or the facility to say, I'm contributing to an HSA. That money comes in over time. Can we set up a payment plan that allows me to make payments on a schedule that aligns with my HSA contributions? Does it always work? It does not. But it's something that I think more organizations are familiar with, so there is some of that flexibility built in. But if you choose the less expensive plan and it's $500 a month and you don't have an additional 500, you're picking the lower cost plan because it is the lower cost plan. You can use that $500 to spend on rent, groceries, utilities, life. You still have an option to contribute something. So if you treat it like another bill, and even if you contribute $25 to your HSA, it does set you up to pay for some of these other expenses with the HSA dollars, and they're set aside pre-tax. It's a lot of math to math, but it's worth it. This is expensive. This is expensive.
It
So let's
is.
talk about the network.
Yeah. So, which providers are in network? Is it a regional network, a national network, a narrow network? Right. lots to talk about here. So a narrow network might cost you less to enroll, but it's important to check to see if your current providers are in network or if you'd be willing to change providers to a new in-network physician.
Yeah. So national networks, they have a lot of coverage, even regional networks. If you're not, you know, traveling nationally a lot, or you're home, a regional network could be great. The narrower networks, you could have a plan option that looks exactly the same in every way, shape, and form, except the network option is different. It's important to look at the narrow network option, which might have a lower cost to enroll in it. Just check to make sure your providers are in it. Or if you're willing to change providers, right? Then you make the change to save the money on the plan. But that's important.
You got to think about how often you travel. So where do you go? Do you know what coverage you have when you travel? Probably not. I mean, let's be real. Nobody's researching this stuff, but you should if you travel a lot. In an emergency, you'll have some coverage, but if you're working from your daughter's condo in Florida for a week and you get sick, what's the best option to save money where you can? So I think we mentioned it on a few previous episodes that people spend more time researching vacations or like electronics that they're going to buy on Amazon. You spend an hour reading the reviews. Might be worth it to spend some time understanding the networks that are available to you.
Especially in a world of remote work where more people have the opportunity to work from a different location. It's worth knowing what kind of coverage you have if you're going to choose to work from a different location for a short period of time. 100%.
So now we're going to shift gears and look at copays and coinsurance cost.
Yeah. And if you're a healthy 27-year-old, you're probably picking that high deductible plan. It's $500 a month. It's a total of $3,000 a year. You've saved money off the bat. You're probably not going to the doctor a whole heck of a lot except for preventative visits and screenings. You might take generic medications if you have any. Add it all up. That might make the most sense. If you're a 35-year-old with a chronic condition, though, or you've had an accident or injury the year prior where you can kind of estimate you might need a little more care, physical therapy, the chiropractor, specialists, high or mid-cost prescriptions, HDHP, a high-deductible health plan, still might make more sense because it's $9,000 out of the gate versus the 12, and that's where you have to start to do the math on those copays and coinsurance costs.
And if you're 42 and married with 2 kids, you have some choices to make. Open enrollment is coming up here for us, and I know I have some evaluating to do. So how often do you and your spouse visit the doctor? In general, we wanted to frame up some ways to think about plans you have and all the plans that you have to choose from. So how to determine what the real cost of the plan is and how to choose the right plan for you based on how you use your medical benefits. The best piece of advice we can give is that benefits have open enrollment every single year. So take some time, reevaluate the plan you're choosing, especially if your circumstances change. If someone is taking up skiing for the first time,
Your hospital
you know,
coverage.
yeah, you might want to see what's up there.
I think this is way more math than any of us really want to do, but healthcare is expensive. I mean, we work on the plan administration side, but we also have a health plan. It's worth the time to take it up front and understand what you're getting so that you choose the plan that you need based on the way you plan to use benefits. It's a lot. So if this episode helped you make your decision easier, pass it along to a friend or a coworker. And next up, we're going to demystify FSAs and HSAs because those are confusing accounts, but can absolutely help you save some money.
100%. Thank you for listening.
Thank you for listening.
This podcast is brought to you by Nova Healthcare Administrators.
Have a question or a situation you'd like advice about?
You can find us on X at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like or subscribe, but most importantly, share. We'll find the insiders.
You share it with the outsiders.